Welcome, students. In the previous sessions, we have discussed the definition, properties, factors that affect enzymatic reactions, the nomenclature system, the general mechanism of enzyme actions, and the kinetics of enzyme action. In the today's session, we'll discuss about enzyme inhibitors. Enzyme inhibitors are chemical molecules that interfere with the catalysis process of the enzyme so that they slow down the enzyme action. And these inhibitors are classified into three based on their action. Some enzyme inhibitors are normal metabolites that are produced in our body and important for controlling the normal metabolic process of the body. The other types of enzyme inhibitors are drugs that are designed to treat different types of diseases. And the third type of inhibitors are toxic chemicals that can be lethal to our body if they are taken in higher concentration than the maximum limit. Okay, now these inhibitors can be reversible or irreversible. Reversible inhibitors bind to the enzyme molecule and can easily dissociate from the enzyme molecule, whereas the irreversible inhibitors bind to the enzyme covalently, commonly by reacting with the amino acids in the active site or nearby the active site, so that they can block the enzyme permanently. Now, next we'll talk about the types of reversible inhibitors. Reversible inhibitors are inhibitors that bind to the enzyme and can easily dissociate so that they can be easily released from the enzyme molecule so that the enzyme activity can be regained. Okay? Now these reversible inhibitors are categorized into three based on their mode of action. Okay? Now there are competitive inhibitors, non-competitive inhibitors, and uncompetitive inhibitors. The competitive inhibitor is active site directed because it binds to the active site of the enzyme, whereas the non-competitive and uncompetitive inhibitors bind to the allosteric site, what we call other site than the active site of the enzyme. Okay, now let's look each of them in a little bit detail. Okay, competitive inhibitors. Competitive inhibitors bind to the active site of the enzyme so that the inhibitor has very close structural similarity to the normal substrate of the enzyme. Okay, so the enzyme can bind either the substrate or the inhibitor. If the enzyme binds the substrate, reaction will occur and product will be formed. Whereas if the inhibitor binds to the enzyme, there will not be reaction and product formation will be impaired. Okay? Now, the competitive inhibitors, as I have said earlier, they bind to the active site. So there is a competition between the inhibitor and the substrate. So because of that, if you increase the substrate more and more, then what will happen? The inhibitor effect will be easily removed, so that the good mechanism to remove the effect of competitive inhibitor is increasing the concentration of the substrate. Now, whereas because there is no effect on the catalysis process, the maximum velocity of the enzyme can be reached, so that Vmax remains constant, whereas the Km of the enzyme increases. If it is in allosteric enzymes, the K 0.5 of the enzyme increases in the presence of competitive inhibitors. Now let's look some examples. Now let's look some drugs that can act as competitive inhibitors. Let's look at the drug that is used for treatment of gout. Now, gout is caused by increased production of uric acid. Now, if we give the drug allopurinol, allopurinol competitively inhibits xanthine oxidase enzyme and decreases the production of uric acid. Thereby, the gout can be easily treated by giving allopurinol to patients. The other is methotrexate, which is commonly used to treat cancers, especially blood cancers. Okay, this methotrexate is competitive inhibitor of dihydrofolate reductase enzyme, which is important for formation of tetrahydrofolate that is used as cofactor for production of nucleotides, which is important for DNA replication, so that by doing that, if we inhibit the production of nucleotides, so DNA replication will be decreased, so cancer cell proliferation will be decreased. Okay, the other is statin drugs. These drugs are of different type, and they are used to inhibit the enzyme known as HMG-CoA reductase. HMG-CoA means hydroxymethyl-glutaryl-CoA reductase enzyme. Now, when you inhibit this HMG-CoA reductase enzyme by statin drugs, there is decreased production of cholesterol in our body, so that these drugs are used to treat hypercholesterolemia. Okay, the other drugs that are commonly used is the non-steroidal anti-inflammatory drugs, which are inhibitor of cyclooxygenase enzyme. This cyclooxygenase enzyme is important for production of prostaglandins, which are mediators of inflammation. Okay, now if you give non-steroidal anti-inflammatory drugs like paracetamol, then these drugs inhibit the cyclooxygenase enzyme, thereby production of prostaglandin decrease, so that pain will be relieved. Okay, the other is, let me add one other example, that is warfarin and decumarol. Now, this warfarin and decumarol are given to relieve clotting. Okay, and it is these drugs are inhibitors of vitamin K reductase enzyme, so that they block the production of active vitamin K, so that blood clotting will be blocked. Okay, next let's look the second type of reversible inhibitors, that are uncompetitive inhibitors. Now, these uncompetitive inhibitors are type of inhibitors that are generally very dangerous and toxic. Okay, and they bind to the enzyme substrate complex, not to the free enzyme, so that what happens in reality is, when the substrate binds to the active site of the enzyme, there is shape change enzyme in the enzyme molecule. That shape change causes opening of the allosteric site, so that the uncompetitive inhibitor binds to the allosteric site and inhibits the enzyme action. Okay, in the presence of uncompetitive inhibitors, there is decrease in both Km of the enzyme and Vmax of the enzyme, and most of the chemicals that act as uncompetitive inhibitors are toxic chemicals. The third type of reversible inhibitors are non-competitive inhibitors. Like that of uncompetitive inhibitors, these non-competitive inhibitors bind to allosteric site, so that they are known as non-active site directed inhibitors. Okay, now these the non-competitive inhibitors can bind to the free enzyme or to the enzyme substrate complex. So in this condition, what happens? If the substrate binds first, and before the binding of the inhibitor, if the enzyme carries out the reaction, product will be formed. Okay? But whenever the inhibitor binds, either before the substrate or after the substrate, the production of the required metabolite will not be processed, so that there is a possibility that product formation can happen. Okay, now this the as I have said earlier, the enzyme can bind both the inhibitor as well as the substrate, so that the Km off, because there is change in the shape of the enzyme, the Km of the enzyme remains the same, because there is no competition, there is no binding of the inhibitor to the active site, so that the Km remains the same, whereas the Vmax will decrease. Okay, so there are different types of chemicals that can act as non-competitive inhibitors, like mercury iodide, for example. Okay, heavy metals like lead, like silver and mercury, and different types of toxic chemicals can act as non-competitive inhibitors of the enzymes. Okay, and we have only one drug that I know, that is pepistatin, which is inhibitor of renin enzyme and used to treat hypertension. Okay, now this is all about our today's session. In the next session, I will come with discussion of irreversible inhibitors, which are permanently inhibiting enzyme activities. Thank you for watching. Don't forget to like, share, and subscribe this video. So I will come back with the next session in a few days. Thank you very much.